Disclaimer: this video serves as an informational resource, not as professional advice. The content shared here is intended for general knowledge and should not be considered a substitute for guidance from qualified professionals. It is crucial to seek advice tailored to your individual circumstances before making decisions or taking action based on the information provided in this video. If you have any medical concerns, it's important to promptly consult with your doctor or healthcare provider. If you suspect you may be experiencing symptoms of major depressive disorder, MDD, or any other medical condition, seek immediate medical attention. While I endeavour to ensure the accuracy and relevance of the information presented in my videos, I cannot guarantee its completeness, accuracy, or timeliness. And also, sorry for the background noise. Hi, and welcome back to Mindful Advocate, where we talk about mental health and wellness. Today, we'll be discussing one of the most common mental health disorders that affect millions of people worldwide, major depressive disorder, or MDD. We'll be covering important facts about this disorder, its symptoms, causes, and treatment options. So let's get started. Major depressive disorder, also known as clinical depression, is a mental health condition that affects a person's mood, thoughts, and behavior. It is characterized by intense feelings of sadness, hopelessness, and worthlessness that persists for weeks, months, or even years. People with MDD often lose interest in activities they once enjoyed, have trouble sleeping or sleeping too much, and experience changes in appetite and weight. They may also have difficulty concentrating, making decisions, and experience physical symptoms such as headaches, stomach problems, and body aches. MDD is a prevalent mental health condition that affects millions of people worldwide. According to the World Health Organization, more than 264 million people suffer from depression globally, and it is the leading cause of disability worldwide. According to Joe Pinder's article on championhealth.co.uk, depression stands out as one of the most widespread mental health conditions, impacting approximately 1 in 6 adults across the UK. It often coexists with other mental health challenges, including anxiety, stress, and feelings of isolation. Studies indicate that women are twice as likely as men to grapple with depression, yet only 15% of affected women seek treatment, in contrast to a mere 9% of men. Throughout the UK, depression rates have surged notably since the onset of the pandemic. In the summer of 2021, approximately 17% of adults experienced symptoms of depression, a stark increase from the pre-pandemic figure of 10%. Beyond its implications for public health, depression poses significant hurdles for organizations to navigate. The exact cause for MDD is unknown, but it is believed to be a result of a combination of genetic, environmental, and biological factors. Imbalances in certain chemicals in the brain, such as serotonin and dopamine, may also contribute to the development of MDD. Additionally, medical conditions such as chronic pain, thyroid problems, and heart disease can increase the risk of depression. While I haven't received a diagnosis for major depressive disorder, I've grappled with symptoms that mirror its effects. Sleeplessness plagued me as I struggled to drift off each night, while lack of motivation kept me confined in my bed for extended periods. Appetite loss led to significant drop in weight, and I found myself withdrawing from social interactions. It wasn't until I sought help from a therapist and began a combination of medication and therapy sessions that I noticed a positive change in my life. I'm incredibly grateful for the support of my family, friends, and mental health professionals whose guidance expedited my recovery journey. I urge anyone experiencing similar struggles to muster the courage to seek help. Speaking out and seeking support from therapists, support workers, or psychiatrists can pave the way to healing. Don't let fear hold you back. Take that step towards recovery. This digital painting I'm working on is called MDD. It's portraying a person crafted from stone, capturing the feeling of being trapped in sadness and depression. The figure's rigid posture reflects the heavy weight of their emotions, emphasizing the immobility and struggle often associated with mental health challenges. The man in stone symbolizes a sense of being stuck, unable to break free from the grip of despair. In the background, towering leaves from lush plants offer a stark contrast to the figure. This vibrant foliage represents the potential of healing and growth, suggesting that despite the darkness of depression, there is hope for renewal and vitality. However, the choice to embrace this opportunity lies with the individual depicted, highlighting the importance of personal agency in overcoming mental health obstacles. The painting invites viewers to contemplate the contrast between stagnation and progress, urging reflection on the possibility of transformation amidst the throes of depression. It serves as a reminder that while the struggle may feel insurmountable, there is always the potential of growth and resilience, should one choose to reach out and seek it. MDD is treatable, and there are several effective treatment options available. The most common treatment for MDD is a combination of antidepressant medication and psychotherapy. Antidepressants work by balancing the level of certain chemicals in the brain, while psychotherapy helps people learn coping skills and strategies to manage their symptoms. In severe cases, electroconvulsive therapy, ECT, may be recommended. ECT is a safe and effective treatment that involves passing an electric current through the brain to produce a controlled seizure, which can help relieve symptoms of MDD. In addition to professional treatment, there are several self-help strategies that help with MDD and manage the symptoms. These include getting regular exercise, eating a healthy and balanced diet, getting enough sleep, practicing relaxation techniques such as meditation or yoga, and avoiding alcohol and drugs. Social support from friends and family members can also be helpful in managing depression. If you're struggling with depression or any other mental health condition, you don't have to go through it alone. Online therapy can be a convenient and effective way to get the help you need. Companies like BetterHelp offers online therapy with licensed therapists from the comfort of your home. You can schedule sessions at a time and place that works for you and communicate with your therapist through secure messaging, phone or video chat. Also, you have other options available in the UK, such as NHS mental health services, Mind, Samaritans, Calm, Campaign Against Living Miserably, Rethink Mental Illness, Anxiety UK, and Beat. My digital painting, MDD, along with other artworks, is available to buy on my website. You can find the link in my author's bio. Additionally, my website features a blog where I delve deeper into the topic of MDD and other mental health topics. Feel free to explore and engage with the content to gain further insight into the subjects portrayed in my paintings. In conclusion, major depressive disorder is a common mental health condition that affects millions of people worldwide. It is essential to recognize the symptoms and seek help from a mental health professional if you're experiencing any signs of depression. MDD is treatable, and there are several effective treatment options available, including medication, psychotherapy, electroconvulsive therapy. Additionally, self-help strategies such as exercise, healthy eating, and social support can be helpful in managing depression. I hope this video has provided you with valuable information about major depressive disorder, MDD. If you enjoyed this video, please give it a thumbs up and share it with anyone who may find it helpful. Don't forget to subscribe to my channel for more mental health content. Thank you for watching. Bye.